You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, mommy makeovers. My first guest is a board-certified plastic surgeon that is helping women throughout Fresno and California, for that matter, look better after pregnancy. Dr. Mark Chin. Dr. Chin, welcome to the program.
Well, thank you for having me.
Now, before we get into today's topic, tell me a little bit about your practices. You have two.
Yes. I've been in practice in Fresno for 15 years now.
All right.
And it has a combination of a Medi-Spa, but also a surgery center.
Two separate facilities?
It's under one house.
So they're attached, but one's a Medi-Spa,
Yes.
one's a surgery center. Okay.
We concentrate on surgical procedures and offer a wide variety of different surgery, but I also want to complement it with some non-surgical procedures. Sometimes patients aren't even ready for surgery, but yet they're looking for rejuvenation, they're looking for body shaping. They're just trying to improve the quality of their skin and their body.
Okay.
So that doesn't necessarily mean surgery. So I offer them non-surgical, less invasive procedures, but then also we have the option of going to with surgery to treat surgical problems.
Now, you compared yourself to like a body shop. Elaborate on that.
Well, I often describe as the best...
You tell this to your patients.
Yes, I do. I'm like the body and fender guy, and I'm working on their dents and the dings. But they also need some detailing, and so I have the Medi-Spa, which includes a nurse,
All right.
an aesthetic nurse, and a licensed esthetician who help me with working on the skin, trying to maintain what we were able to accomplish with surgery. So it's kind of a maintenance. It's also improving the quality of the skin, because surgery often doesn't treat the quality of the skin. It gets rid of some of the bad tissue. It puts things back into place. But now we want to improve the quality of the skin. We're trying to reverse some signs of aging, but
So
also...
you have lasers and intense pulse light machines. You do Botox fillers. I mean, you do everything there?
Yes. I have an aesthetic nurse, and we both do Botox and fillers. We have ELOS, which offers intense pulse light, laser hair removal.
So that's, now the ELOS, by the way.
Yes.
That, it like heats the skin and what, produces more collagen? What is it?
It's a unique system that it depends on what we're trying to treat. Oftentimes with the aging skin, we're treating hyperpigmentation, texture, tone, and also doing some tightening. And a lot of patients aren't ready for surgery, but this technology can combine different types of modalities such as radiofrequency, infrared energy, laser, intense pulse light to give a safe and effective method of rejuvenating the skin. We're improving the quality of the skin. We're able to do non-invasive procedures, but then let's say they want to have a more of aggressive approach. Then we have an Active FX, which uses CO2, fractional CO2 resurfacing, in order to give a more of a quicker response. And
so like a fractionated
yes.
laser, okay.
We have fractionated CO2 system now, which CO2 has been the gold standard over the years, but now that they've fractionated it, becomes safer, it's a faster recovery time, less redness and edema.
So are you kind of a technology nut? I mean, you have all the new stuff. Where do you stand on technology?
We do have high-tech systems in our practice. I find that I can't achieve all the results just by surgery alone.
Okay.
And so it helps complement the surgical results. For example, I think I do a decent facelift, and things are tightened, but they still have discoloration of the skin. We're trying to improve their complexion. In fact, I have a Visia complexion analysis machine. It does a computerized analysis of their skin, and we develop a treatment plan based on what we find. It shows UV damage, spots, age spots, hyperpigmentation, redness. And then
do you use some of these technologies, by the way?
I've had photofacial.
Because I know your age, and you look at least, I'm looking at the monitor, about 12 to 15 years younger than you really are. Well, so good for you.
Well, thank you. I use the photofacials in order to help improve my skin color. My staff say I need Botox, but I haven't used that yet.
All right, all right. Now, did you always know you wanted to be a plastic surgeon, by the way? I always ask that to the doctors on the show.
I always was interested in anatomy, even in high school. I like the body and I like the body parts. And so as I developed an interest in medicine, I know I wanted to have more of an immediate effect. And that meant something like surgical, where we have the old saying, cut to cure. And so, in fact, one of the most fascinating things during my general surgery residency was working with a heart surgeon, Dr. Bailey, where we had a patient laying on the table. The heart was literally out of the body. We were waiting for the new heart to come in an igloo, and we transplanted that heart into the patient, warmed the body up. It started to quiver. We gave a little jolt to the heart, and we just
So you were hooked.
You just see life. And so I didn't go into heart surgery, but that was just the effect of having a surgical procedure. You can fix what was broken. And so then I developed an interest in the different specialties, and plastic surgery gave me the most options, working from head to toe, working from congenital, trauma, aesthetic surgery. So that gained my interest.
Okay, good. Now we're going to move into today's topic, mommy makeovers. What is a mommy makeover in your mind? How do you define it?
Well, I think we have to look at what the mother is going through.